Alright, I had to pause the video because I had to use the restroom. So, back to where we were. We're going over table 3.2, metabolic pathways and their planetary rulers. So we see our pathway, glycolysis, the planet associated as Mars, the sign associated as Aries, substrate associated as glucose, pyruvate, and the astrological dysfunction signature, or our ADS, our ADS, is rapid glycolysis. Mars leads to lactic acidosis under Mars-Saturn opposition. Alright, gluconeogenesis, Saturn, Capricorn, lactate alanine glucose. Excessive gluconeogenesis under Saturn transits causes stress, hyperglycemia. Glycogenesis, Moon, Cancer, glucose, glycogen. The moon's phase controls glycogen storage. Full moon equals peak glycogen. Glycogenolysis, Uranus, Aquarius, glycogen, glucose. Sudden glucose release under Uranus square, moon, causes unexpected hypoglycemic events. Fatty acid oxidation, Jupiter, Sagittarius, fatty acids, acetyl-CoA, beta oxidation increases with Jupiter transit, impaired by Jupiter retrograde leading to fat accumulation. Ketogenesis, Pluto, Scorpio, acetyl-CoA, ketone bodies. Ketoacidosis is a Pluto-Mars square. Ketone bodies are plutonic depths surfacing. Sun, Leo, for cholesterol synthesis, acetyl-CoA to cholesterol. The heart's solar need for cholesterol is governed by the sun. High LDL is a Sun-Saturn heart aspect. Bile acid synthesis, Mercury, Virgo, cholesterol, bile acids. Bile acid malabsorption occurs under Mercury retrograde in Virgo. Cytochrome P450, detox, Venus, Libra, xenobiotic hydroxylation. The phase 1 balance is Venusian. A Venus-Mars square causes rapid, slow metabolism mismatch. Urea cycle, Jupiter, Saturn, Pisces, Capricorn, ammonia, urea. Hyperammonemia under Jupiter-Neptune conjunction. The brain fog is Neptune's dissolution. Albumin synthesis, Venus, Taurus, protein synthesis. Low albumin is a Venus-Saturn opposition. The body's nurturing Venus is starved. The brain and nervous system, the Mercurial-Uranian network. So the brain is the Mercury-Uranus interface. The brain is the organ of Mercury, the neural circuitry, the wiring of its caudician staff. The cerebrum is mercurial, cognitive, dual hemisphere like Gemini. The cerebellum is lunar, unconscious habit. The brainstem is Saturnian, primitive survival, rhythm. The synapses are Uranian, electric, sudden, unpredictable, connecting the higher mind to the body. Neurotransmitters are specific planetary liquids. Dopamine is Mars, drive, while serotonin is Venus, harmony. Acetylcholine is Mercury, speed. Norepinephrine is Jupiter, alertness. GABA is Saturn, inhibition. And endorphins are Neptune, pain dissolution. The natal horoscope of a neuron. We see a circular chart modeled as a natal chart, but with the cell body as the ascendant. Dendrites as the first house, the axon as the midheaven, action, potential, direction, the synapse as the descendant, communication with others, and the myelin sheath as the fourth house, cusp, foundation, Saturn. The neurotransmitters are assigned house positions based on their function. This visualization trains the astroneurologist to see every neuron as a fated entity with its own fixed transiting influences. Seizures and the Uranian storm. A seizure is a sudden, uncontrolled electrical discharge of the brain ruled purely by Uranus and hard aspect to Mercury, Mars, or the ascendant. Seizure threshold is natal. A tight Mercury-Uranus square in a chart indicates a lifetime of electrical instability, but the actual ictal events are predetermined transits. Seizure semiology and exact transits. Seizure type, natal brain signature, trigger transit, onset time, and post-ictal course. Alright, so generalized tonic-clonic, Mars square Uranus, Mars in fixed signs, transiting Uranus conjunct the natal Mars, transiting Moon crossing the 12th house. At the exact minute the transiting Moon squares natal Uranus, confusion lasts until the transiting Moon trines natal Mercury. Absent seizure, Mercury conjunct Neptune, Mercury in Pisces, transiting Neptune square natal Mercury, Moon void of course, sudden blank at the Moon-Neptune conjunction, return at the next lunar aspect, no memory, Neptune has dissolved the record. Temporal lobe, déjà vu, Moon in Cancer squaring Neptune, nodes in the 8th second, transiting Rahu, conjunct the natal Moon. At the moment of lunar transit over the IC, psychic content of the aura is a memory from the Akashic record predetermined. And status epilepticus, Mars-Pluto opposition, Saturn in the 8th, transiting Pluto opposite the natal Mars, transiting Mars square the natal Saturn. Continuous seizure until the transiting Moon enters a new sign, death or cessation at the exact Pluto-Mars transit separation. ICU care is ritualistic. Strokes, the mercurial Saturnine interruption. A cerebrovascular accident is a Saturn-Mercury event, so the blockage is Saturn of the neural messenger Mercury. Hemorrhagic stroke is Mars rupture in a mercurial territory. The territory affected is mapped to the brain, homunculus, by astrological house cusps. Let's look at stroke territories and their astroanatomical correlates. So look at the brain region, ruling sign planet, function, stroke deficit, and fated transit for infarction. Okay. Alright, so your frontal lobe motor, ruling sign planet for this is Aries. The function is executive will. The stroke deficit is hemiparesis, loss of initiative. The fated transit is transiting Mars square natal Mercury. The will is immobilized exactly as Mars station retrograde. Parietal lobe, sensory, Taurus, Venus, sensation, spatial, neglect, agraphesthesia, transiting Saturn opposition natal Venus. So the body half is abandoned by Venus. Temporal lobe, Wernicke, Gemini, Mercury, language comprehension, receptive aphasia, transiting Mercury retrograde, square to natal Neptune, words become sound without meaning. Broca's area, frontal, Virgo, Mercury, speech production, expressive aphasia, transiting Saturn conjunct the natal Mercury, so the speech is locked inside exactly during a Mercury-Saturn conjunction. Occipital lobe, Cancer, Moon, vision, homonymous, hemianopia, transiting Moon square natal Sun, so the visual field is cut at the lunar solar angle. Cerebellum is Pisces, Neptune, Jupiter, coordination, ataxia, transiting Neptune square to natal Mars, balance dissolves into the Neptunian fog. And brainstem is Capricorn, Saturn. Vital centers, locked-in syndrome, transiting Pluto square to natal Saturn, consciousness is preserved while the body is entombed, a plutonic underworld. Currently going live right now, someone's on stream. What's up? Hold up. We're going to go over the kidneys. And then I have... What's that? Okay. So, looks like we just have one more essay left, actually. And then we're going to go over my appendixes. So, the kidneys, the Venusian Libran filter. The kidneys are the scales of Venus. So the kidneys are ruled by Venus and Libra, the sign of balance, partnership, and filtration. They maintain the exquisite equilibrium of electrolytes, acid base, and fluid volume, the Venusian harmony of the internal environment. The glomerulus is a mesh of Venusian beauty. The tubules are mercurial transporters. Renal failure is a breakdown of the Venusian scales, a Saturnine weight crushing the delicate filter. The nephron as a Libran mandala. A detailed diagram of a nephron rendered as a balancing scale. The glomerulus at the top is the fulcrum, the sun. The efferent and efferent arterioles are the two arms of the scale. The proximal tubule descends on the left pan, Venus. The loop of Hinel is the descending and ascending arm, Saturn to Jupiter. The distal tubule is the right pan, Mars, and the collecting duct is the base, Moon. The final urine composition is the balance point, faded by the natal Venus-Saturn relationship. Acute kidney injury, or AKI, in a Saturn-Mars transit. So AKI is a sudden assault on the Venusian filter. The three classical types are pre-renal, intrinsic, and post-renal. These are astrologically distinct. We're going to look at AKI etiologies and their astrological triggers. We have our AKI type, our astral cause, our trigger transit, and creatinine trajectory. So pre-renal, hypoperfusion, Mars square Sun, volume depletion. Transiting Mars square natal Sun, transiting Saturn opposite Moon, creatinine rises at 0.3 mg/dl per day during Mars transit, returns to baseline exactly at Venus station direct. Acute tubular necrosis, or ATN, is Mars conjunct Saturn and nephron, transiting Saturn conjunct the natal Venus, transiting Uranus square Venus. Oliguric phase lasts precisely one lunar cycle. Recovery at the next new moon if Venus receives a trine. And acute interstitial nephritis, Mercury square Jupiter, allergic, transiting Jupiter square natal Mercury, drug-induced hypersensitivity. Eosinophiluria peaks at the Jupiter station, response to steroid only if transiting Venus trines the natal Jupiter. Post-renal, obstruction, Saturn in Scorpio, blockage, transiting Saturn square natal Pluto, transiting Moon in Capricorn, opposite Saturn. Hydronephrosis visible at the exact Saturn station, so relief at the Mars-Uranus transit, catheter insertion. Chronic kidney disease and the Saturn progression. The progressive loss of nephrons is a Saturnine march. The EGFR decline is a linear, with the slope determined by the natal Saturn's position and aspects. A patient with Saturn in the 6th house squaring Venus will lose exactly 4 ml min 1.73 m squared per year. Dialysis initiation is fated at the Saturn return or to Pluto square Saturn. The arteriovenous fistula is created under a Mars-Venus trine. Its maturation is a Venus cycle. Stages of CKD and corresponding Saturn transits. We have our CKD stage, EGFR, and Saturn transit to natal Venus, as well as the karmic event. Stage 1 through 2 is being greater than 60. Saturn in the 12th house hidden, asymptomatic. Venus is still harmonizing. Stage 3 is 30 through 59, Saturn square Venus. First nephrology referral, the patient feels the imbalance. Stage 4 is 15 through 29, Saturn opposition Venus, AV fistula placed, the body prepared for the Pluto conjunction, dialysis. Stage 5 is being lesser than 15. So Saturn conjunct Pluto are square. Dialysis initiation at the exact Saturn-Pluto transit, renal transplant, if applicable, at Jupiter trine Sun. Now let's look at Appendix A, comprehensive tables of organ planetary correspondences. We have the astrological body here, the full organ ruler transit matrix. So we have our organ system, ruling planet, ruling signs, secondary ruler, key pathology transit, diagnostic transit. And this is a pretty long one, so. Fully detailed. All right. So the heart, we know, is the Sun, Leo, Mars, your ventricles. Sun squares Saturn, transiting Sun conjunct the natal Mars. That's our key pathology transit, by the way. So we'll say our KPT and then we also have our diagnostic transit. We'll say our DIT. All right. So, blood, so red blood cells, Mars, Aries, Scorpio, Sun, Mars opposite Uranus, Mars retrograde station. Blood, WBC, Moon, Mercury, it's Cancer and Gemini. Mercury retrograde square Neptune, Moon void of course. Lungs is Mercury, Gemini, Virgo, Saturn structure, Mercury square Saturn, transiting Neptune opposite Mercury. Brain is Mercury and Uranus, Gemini, Aquarius, Moon, Uranus square Mercury, transiting Mars conjunct Uranus. The liver is Jupiter, Sagittarius, Pisces, Venus, Glycogen, Jupiter square Saturn, transiting Mars conjunct Jupiter. All right? Going down here. Oops. Just so we have it down here. Okay. All right. So your gallbladder is Mars, Scorpio, Saturn, stones. Key pathology transit, or KPT, is Mars square Saturn, and it's, I'll just say it's DT, is transiting Moon square Mars. For the kidneys, we see it is Venus, oops, it's a different color, Libra, Taurus, Mercury tubules, Venus square Saturn, transiting Saturn conjunct Venus. Bladder is Moon, Cancer, Pluto, control, Moon square Mars, transiting Moon in Scorpio. Spleen is Saturn, Capricorn, Aquarius, Mars, blood storage, Saturn opposite Mars, transiting Pluto square Saturn. Stomach is Moon, Cancer, Jupiter, digestion, Moon square Neptune, transiting Mars square the Moon. Pancreas, endocrine, is Jupiter, Sagittarius, Venus, isolate, Jupiter square Neptune, transiting Saturn square Jupiter. Pancreas exocrine is Mercury, Virgo, Mars enzymes, Mercury square Mars, transiting Mars opposite Mercury. Thyroid is Mercury, Gemini, Pluto, autoimmune, Mercury square Pluto, transiting Uranus conjunct Mercury. The adrenals are Mars, Aries, Scorpio, Jupiter, Cortex, Mars opposite Neptune, transiting Pluto square Mars. Bones are Saturn, Capricorn, Sun, Marrow, Saturn square Sun, transiting Saturn return. Muscles are Mars, Aries, Mercury, innervation. So Mars square Neptune, transiting Mars retrograde. Skin is Saturn, Venus, Capricorn, Libra, Mercury. Venus square Saturn, transiting Saturn square the ascendant. The right eye is Sun, Leo, Sun square Mars, transiting Moon square Sun. The left eye is Moon, Cancer, Moon square Saturn, transiting Sun, opposite the Moon. Our ear is Saturn, Capricorn, Mercury, Saturn square Mercury, transiting Mercury retrograde. Alright, and there we go. Now let's go over the humors revisited, quantum elemental fluids. We're going to look at the humor, the modern correlate, the element, planet, organ, imbalance, transit, and physical sign. We'll say our IT. And then we'll say RPS for physical sign. So for example, blood, phlegm, yellow bile, black bile, and ichor. So blood, modern correlate is oxygenated hemoglobin. Air, Jupiter. Heart, liver, Jupiter square Mars, ruddy complexion, hemorrhage. Phlegm is lymph, CSF, mucus, water, moon, brain, lungs, Moon square Neptune, edema, congestion, mental fog. Yellow bile, gastric acid, bile, fire, Mars, gallbladder, and stomach. Mars square Jupiter, hyperacidity, rage, inflammation. Black bile is methemoglobin, old blood, earth, Saturn, spleen, bone, Saturn square Moon, melancholy, fibrosis, chronicity. Ichor is plasma, interstitial fluid, ether, Neptune, all tissues, Neptune square Venus, autoimmunity, leakage, mystical illness. Let's look at our fixed star anatomy, the celestial body map. So the fixed stars are acupuncture points on the cosmic body, each one corresponding to a specific anatomical locus. Transits of planets over these stars trigger fated events in the corresponding organ. We're looking at fixed stars and their anatomical reign. Fixed star, longitude, organ part, activation effect. Algal, right? 26 degrees Taurus, head, carotids, sudden decapitation energy, stroke, carotid dissection, and beheading and trauma. Aldebaran, 10 degrees Gemini, right eye, heart, the bullseye, myocardial tear, retinal artery occlusion. Alright, so Rigel is 17 degrees Gemini, left foot, gout, plantar fasciitis, the Achilles heel. Betelgeuse, 29 degrees Gemini, right shoulder, rotator cuff rupture, burst of fiery inflammation. Sirius, 14 degrees Cancer, stomach diaphragm, the dog star's bite, gastric perforation, hiatal hernia. Regular at 0 degrees Virgo, heart of the lion, royal heart attack, successful surgery of Venus transit. Technically it's Leo, I know. Spica, 24 degrees Libra, ovaries, testes, fertility, gonadal tumors, a spica divergent. Antares, 10 degrees Sag, colon, appendix, the scorpion sting, appendicitis, inflammatory bowel perforation. Vega, 15 degrees Capricorn, knees, the liar's fall, patellar fracture, ACL tear. Informal hot, 4 degrees Pisces, feet, lymphatics, the mouth of the fish, lymphatic filariasis, immersion foot. So here's the use of the fixed star anatomy table. When a malefic transits over a fixed star and simultaneously aspects a natal planet in the corresponding organ's natal house, the pathological event is certain. The astromedic does not wait for symptoms, they order a predetermined imaging study. Appendix C, the transit to organ failure chart, which would be a graph. Multi-organ failure cascade as a sequence of transits. So what we would see, if I actually map this out, is a complex color-coded Gantt chart spanning a 7-day ICU course. So the top row is a transiting moon's phase. Rows below are organs, lungs, kidneys, liver, heart, coagulation, brain. Each organ row has colored blocks, indicating failure onset and resolution, aligned with the exact transit times. So for example, lung failure begins at Moon square Saturn, day 1. Kidney failure begins at Mars conjunct Neptune, day 2. Liver failure at Jupiter square Pluto, day 3. Arrows should show the predetermined sequence, so like from respiratory to renal to hepatic to hematologic to cardiovascular to neurologic. The chart demonstrates that MODS is not a random cascade, but an unfolding celestial progression. The final row is death at day 7, aligned with Pluto square the ascendant. This graph is used to teach residents that organ support is merely a synchronous ritual with the transits. The sequence is non-negotiable. Finally, Appendix D is a glossary of expanded terms. We don't have very much, but sure. Akashic Ledger of Forms is a complete celestial database of all possible anatomical structures, and their pathologies of which the corporeal human is projected subset. Astrohepatologist is a specialist in the Jupiter, Venus, Mars metabolic signatures of the liver. Cardiac cyanotic cycle, the 116-day Mars-Sun cycle that governs erythrocyte lifespan and myocardial regeneration windows. Decumbiture chart, organ-specific, a chart cast for the exact moment an organ first fails or produces a pathological sign providing an immutable prognosis for that organ's course. Humoral quantum model, the updated humoral theory that equates the 4 classical humors with quantized energy states of bodily fluids, each with specific planetary resonances. Nephron Mandela is a diagrammatic representation of the nephron as a Libran balance used for teaching renal astrology. Somatic Zodiac is the full mapping of the zodiacal signs, planets, and fixed stars onto the human body, treated as a living deterministic astrological chart. Uranian shock neurological is a specific category of acute neurological events triggered by Uranus transits, including seizures, sudden aneurysmal rupture, and acute demyelination. Thank you for watching this video with peace and love. I appreciate you, and I'll see you in the next one. Piscean out.